Zomig Spray, non-aerosol is used to treat migraines. It helps to relieve headache, pain, and other migraine symptoms, including nausea, vomiting, and sensitivity to light and sound. Prompt treatment with Zomig Spray, non-aerosol can help you return to your normal routine and may decrease your need for other pain medications. This medication belongs to a class of drugs known as triptans. It works by affecting a certain natural substance in the brain called serotonin, which causes narrowing of blood vessels. It may also relieve pain by affecting certain nerves in the brain. It's important to note that Zomig Spray, non-aerosol does not prevent future migraines or lessen how often you get migraine attacks. The typical dosage for Zomig Spray, non-aerosol is 1 spray into 1 nostril. It is best to take it as soon as you feel a migraine coming on, but it can also be used during a migraine attack. Remember to follow the instructions from your healthcare provider and do not exceed the recommended dosage. Before using Zomig Spray, non-aerosol, make sure to read the patient information leaflet from your pharmacist. Use this medication at the first sign of a migraine as directed by your doctor, usually 1 spray into 1 nostril. Avoid spraying into your eyes. Blow your nose gently before using this medication. Remove the protective cap, and block 1 nostril by pressing firmly on either side of your nose. Place the tip of the spray device into the other nostril and breathe in gently as you press the plunger. Keep your head tilted slightly back, remove the tip from your nose, and breathe gently through your mouth for 5 to 10 seconds. Your nose may feel wet inside and you may notice a slight taste after using the spray. This is normal. If there is no improvement in your symptoms, do not take more doses of this medication before talking to your doctor. If your symptoms are only partly relieved, or if your headache comes back, you may use another dose at least 2 hours after the first dose. Do not use more than 10 milligrams in a 24-hour period. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you have a higher risk for heart problems, see precautions. Your doctor may perform a heart exam before you start taking zolmitriptan. She may also direct you to take your first dose of this medication in the office/clinic to monitor for serious side effects, such as chest pain. Talk to your doctor for details. If you are using drugs for migraine attacks on 10 or more days each month, the drugs may actually make your headaches worse. Medication overuse headache. Do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Some people may experience an unusual taste, dry mouth, discomfort in the nose, tingling/numbness, nausea, weakness, drowsiness, or dizziness. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Zomig Spray, non-aerosol may raise your blood pressure. Be sure to monitor your blood pressure regularly and inform your doctor if the results are high. If you experience any serious side effects such as blue fingers/toes/nails, cold hands/feet, chest/jaw/neck tightness, pain, or pressure, or symptoms similar to a heart attack, seek medical help immediately. These symptoms may include chest/jaw/left arm pain, shortness of breath, or unusual sweating. It's also important to be aware that this medication may increase serotonin and rarely cause a serious condition called serotonin syndrome/toxicity. If you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness, seek medical help right away. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed here, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Before using Zomig Spray, non-aerosol, make sure to inform your doctor or pharmacist if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Before using Zomig Spray, non-aerosol, it's important to let your doctor or pharmacist know about your medical history, especially if you have any blood circulation problems, certain types of headaches, heart problems, liver disease, seizure, or a history of stroke. Certain conditions such as high blood pressure, high cholesterol, diabetes, family history of heart disease, being overweight, smoking, being postmenopausal, women, or being over 40 years old, men, can increase your risk for heart problems. Zomig Spray, non-aerosol may cause dizziness or drowsiness, and using alcohol or marijuana, cannabis, can increase these effects. It's important not to drive or use machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana, cannabis. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. The risk of heart disease, liver disease, and high blood pressure increases with age, so older adults may be more sensitive to the side effects of this drug, especially increased blood pressure and heart problems. If you are pregnant, this medication should be used only when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Taking MAO inhibitors with this medication may cause a serious drug interaction. Do not take any MAO inhibitors during treatment with this medication. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. Ask your doctor when to start or stop taking this medication. The risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin. Examples include street drugs such as MDMA/ecstasy, St. John's wort, certain antidepressants, among others. The risk of serotonin syndrome/toxicity may be more likely when you start or increase the dose of these drugs. If you also take any ergotamine medication or other triptan drugs, you will need to separate your zolmitriptan dose from your dose of these other medications to lessen the chance of serious side effects. Ask your doctor how long you should wait between your doses of these drugs. Remember to follow your doctor's instructions carefully. If you or someone else has taken too much Zomig Spray, non-aerosol, and are experiencing severe symptoms like fainting or difficulty breathing, seek immediate medical assistance by calling 911. Alternatively, you can contact a poison control center for further guidance. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. It's important not to share this medication with others. Certain foods, beverages, or food additives like red wine, cheese, chocolate, and monosodium glutamate, as well as lifestyle patterns such as irregular eating/sleeping habits or stress, can trigger a migraine headache. Avoiding these triggers may help lessen migraine attacks. Make sure to consult your doctor for more details. Your doctor may schedule lab and/or medical tests, such as blood pressure checks, while you are using this medication. It's important to attend all medical and lab appointments. Make sure to consult your doctor for more details. This medication is used to treat migraines. It helps to relieve headache, pain, and other symptoms of migraines, including nausea, vomiting, and sensitivity to light/sound. Zolmitriptan belongs to a class of drugs known as triptans. It affects a certain natural substance, serotonin, that causes narrowing of blood vessels in the brain. It may also relieve pain by affecting certain nerves in the brain. Remember to store your Zomig Spray, non-aerosol at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. Each spray device contains one dose, so make sure to discard it after using. When it comes to getting rid of your medication, don't flush it down the toilet or pour it into a drain unless you're specifically told to do so. Instead, consult your pharmacist or local waste disposal company to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.